Hello and welcome to the Daily Show with Molly Roberts. Today we have Ashley Dodson to give us insight on a commonly misrepresented mental illness, dissociative identity disorder. Dr. Dodson is a practicing psychologist with a history of successful treatment of patients suffering from these types of personality disorders. Could you tell us more about your career?
Of course. I've been a doctor of psychology for almost a decade now, with a focus on treating personality disorders like DID. With mental illnesses that can't always be cured, success rates are often considered low. However, even improving a patient's mental state, even slightly, is considered a success in my practice. Anything that helps someone that's mentally ill better cope with their illness and heal is a success, and that's the case with most of the patients that I've worked with.
I don't have a lot of experience with DID outside of how it's portrayed in movies and on TV. Could you explain what this disease is, like what people that are going through it experience?
Certainly. A basic definition of DID is that it's a dissociative disorder that involves a disturbance in a person's identity, in which there are two or more separate personality states or alters that have developed, and they control an individual's behavior at different times. These personality states are entirely distinct from one another. They don't generally have any memories from the time when other alters were in control, and they may not even know that the other alters exist. DID is characterized by selective memory loss. The alter that is generally in charge of the person, so to speak, can experience periods of blackout where they have no memory of what has occurred. For example, they could be driving on their way to work, change alters because of some sort of triggering behavior that happens, and then become their dominant state again 5 hours later in their cubicle at their office and have no idea how they got there or what they've been doing. It's very disorienting, confusing, and disturbing, and incidents like that are often what encourages sufferers of the illness to seek treatment. And anyone can get DID, but it's more common in children, especially female children.
How would you diagnose DID?
You have to take every possible step to make sure that there's not a physical illness or some sort of medication side effect before you even think about a mental illness. Once you determine that neither of those things is the cause for the behavior, you would seek help from a psychology-oriented healthcare professional. The diagnosis is often determined by these interviews and personality assessment tools. Most commonly used is this 28-question screening test about experiences that you may or may not have in your daily life, such as blackouts and memory loss, things like that. How often you have these experiences, and depending on how they answer, it's a pretty good way of determining if you have DID. And it's also the best tool that we currently have at our disposal for diagnosis.
You mentioned something triggered a shift in alters earlier on. It triggers an action or spoken words or behavior that reminds someone of events in their past that have emotionally damaged them in some way, correct?
Yeah, that's an alright definition, especially in this particular context.
What could a person have experienced that would trigger a shift in alters?
Well, DID is associated with severe trauma in childhood, especially in early childhood, mainly abuse and neglect. A person would develop an alter in order to cope with this trauma. It might be a fierce personality that would strike back against abuse, or a stoic personality that could lock the trauma away and thus protect the original identity from experiencing the trauma.
As sufferers of DID grow older, do they experience any problems in life, like depression, or are they able to function like everybody else?
Someone with DID is often maladjusted, especially to life in the real world. They commonly suffer from depression and have suicidal tendencies, anxiety, panic attacks, eating disorders, delusions, memory problems, and they frequently abuse alcohol and drugs. Of course, the symptoms aren't common across all patients, like you could say with any disease, especially mental illness, but they appear frequently. And I would say that patients more often seek treatment for these problems instead of thinking that they have DID. And then, eventually through diagnosis, they would lead to having dissociative identity disorder.
I can assume from what you've already said that DID can be treated. Is that true?
Yes, there are treatments to relieve the symptoms, to ensure the safety of the individual in question, and to try to reconnect the alters into one well-functioning personality. They aren't always successful, but it's better to get treatment and try to recover than to try living with the disorder as it is, because it's very disruptive to have someone living with multiple personalities in their body. We want to help these alters express and process their painful memories of this trauma. We want to encourage them to develop coping mechanisms that do not involve making a new alter. And we want them to develop life skills, and we want to help them function.
Is there any way to prevent DID?
Not experiencing extreme trauma during childhood would be the most obvious way to prevent DID. That isn't something a child can control. If, however, a child receives counseling before DID develops, they can come to terms with these experiences in a positive, healthy way, thus preventing the mental illnesses from developing. However, if they do end up having a diagnosis, we can treat them with psychotherapy, cognitive therapy, medication, family therapy, creative therapy, which would be encouraging the patient to draw or make music, some sort of art, and clinical hypnosis, which is generally the least favorite choice.
Are there any successful media portrayals or famous people that have DID?
There's a book and a movie. They're both entitled The Three Faces of Eve. It's a documentary-style film, still rather fictionalized, about a woman that has 22 alters, and it was based on a real woman. She had 3 alters at a time, and these alters would die in order to make room for new ones. Then in 1977, the real Eve wrote a book. More accurately, her 22nd alter, Caroline Sizemore, wrote a book entitled I'm Eve. As for famous cases, there is a retired NFL star named Herschel Walker who's been undergoing treatment for DID. I haven't treated him personally, but I do know that he developed alters as a child to withstand his abuse. The first alter that he had was fearless and expressed his anger. As he grew older, he then developed more alters which helped him rise to and cope with the fame that he had from being in the NFL.
Thank you for coming here today and reliving some of the common myths surrounding this disorder. I'm sure everyone here is coming away from this talk with a new view on mental illnesses.
Thank you for having me.